The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas, with my Houston surgeons. And on today's podcast, we have Dr. Michael Streitmann, who is also a Houston plastic surgeon. He, however, is a double board-certified plastic surgeon in both plastic surgery as well as ENT. So welcome to the show.
Good to be back.
So tell our audience is a mix of doctors, potential patients, students. So I love to be able to share everything and anything we can so people are most educated on their options in plastic surgery. But let's just start off with, how'd you end up in this field? What brought you here?
Well, I knew I wanted to be a physician, and I knew I wanted to be a surgeon because I like working with my hands, and I knew I wanted to have a family. So I had to kind of narrow things down to professions that would give me time with my kids. So I knew I was either going to be probably a plastic surgeon or an ENT or an ophthalmologist. And I just didn't like ophthalmology. So that's kind of what drew me to the specialty. Plus, I like variety. I think as plastic surgeons, we like doing all kinds of different stuff. And, you know, there's no other specialty that it has more variety than plastic surgery.
100%. I'm actually the daughter of an ophthalmologist, and he wanted me to be so badly. My grandfather was also an ophthalmologist, and I was just like, I can't. Eyeballs all day. It just was too much of the same, like you said. Right. So did you do ENT first or plastics first?
I did ENT first. I did that as my prerequisite training rather than general surgery or orthopedics.
Okay. And then what currently, like when you first started on practice, what was the focus of your practice?
Oh, when I first started, there was no focus at all. It was whatever came through the door, I was going to do. I did a lot of reconstructive surgery starting out, and now I'm pretty much just limited to aesthetic surgery. Okay.
And where would you say, how long have you been in practice, by the way?
26 years.
So just a few years you've been doing that. Right. So it's like, at what point did you transition where you stopped doing reconstructive altogether and you became 100% aesthetic?
Really? I was still, up until a few years ago, still doing about 1/4 reconstructive surgery. And then probably about 2 years ago, I decided to pretty much not do that anymore and just stick with the with the aesthetic surgery.
Okay. Well, what's your passion? So now, you know, like you said in the beginning, we all do whatever comes through the door. But obviously over time, you've been doing this for over 2 decades. You find what you love and what you're good at. So what have you kind of found now your focus to be?
Well, you know, using my ENT background, I pretty much enjoy breast surgery the most.
I love that. That was a good answer. And what particularly about breast surgery like interests you?
It just makes people happy. You know, I mean, when you get good feedback from your patients and you get happy patients, I mean, that just kind of feeds on itself. So I don't really know how I ended up in that little part of the specialty, but I really enjoy breast surgery.
So I know that breast surgery has been evolving a lot, as it has always over time. But right now, breast surgery has really moved towards this idea of breast preservation. And techniques have evolved over time, under the muscle, above the muscle, under the breast, under the fascia. Can you speak to kind of what your preferred technique is now and why?
Well, I still do dual plane submuscular breast augmentation for women who are, you know, have very little soft tissue. I mean, I still think that that's the only place to put the implant when there's just not a lot of coverage available. And when there is coverage available, I like the subfascial breast augmentation.
So to our lay listeners, can you explain what does that mean?
So the implant can either go under the breast tissue, it can go under the covering of the muscle, which is subfascial, or it can go under the muscle itself. So there's really three places to put it.
And though some people will debate that the subfascial plane doesn't exist, I am amongst you that I'm a believer. So I think it's a wonderful plane to be able to put an implant in that's really kind of preserving both above and below. Why, at what point did you feel like that's a plane that you really started rather than going subglandular?
Um, I started doing subfascial breast augmentation in 2003. That's when the first paper came out in the Journal of Plastic and Reconstructive Surgery. I actually even looked it up today, hoping that we would talk about this. I don't know where it came from, but it was all Hispanic authors. But that was 2003, and I read it, and it seemed like it was the best of both worlds as far as, subglandular versus submuscular. And I said, well, I'm going to try it. So I did, and I haven't put one in the subglandular plane since. It's all been either subfascial or submuscular.
Do you notice a difference in recovery, subglandular versus subfascial, or really it's more just that it's a plane that you feel is like a very secure plane?
I don't notice any difference in recovery between subfascial and subglandular. I mean, the submuscular, that's a tough recovery. I mean, that hurts a little bit, but no difference at all in recovery or pain between subfascial and subglandular.
I know that you have a focus on breasts, and it seems like that is a good part of your practice, but you also do quite a few rhinoplasties, if I'm correct.
Yes, still do a lot of rhinoplasties.
So I'm always curious, the patient differences between those who seek augmentations and rhinoplasties. Do you feel like you have to have a very different approach with those patients, or you feel like not really?
Kind of the same. I mean, people come in with very specific wants and needs and problems when it comes to their rhinoplasty. It's usually not just I have a hump on my dorsum of my nose. It's I don't like the hump. I don't like the way the nostril's shaped. I don't like the way the nostril sits. I don't like the width of the nose. I don't like this. I mean, it's a whole laundry list of they've really thought it through. Whereas it seems like with breast surgery, it's a lot easier. My breasts are too big. My breasts are too low. My breasts are too small. It seems like they come in knowing that they want surgery for their breasts, but they don't have a lot of specifics. Whereas a rhinoplasty patient will come in with a list.
Yeah, that's true. They're very, very. How many times have you ended up having your rhinoplasty patient also be your aug patient, or vice versa?
It's happened a couple of times where I actually did a breast augmentation and a rhinoplasty at the same sitting.
Oh, really? Yeah.
Matter of fact, I have one coming up.
I figure it seems like, okay, it's kind of in a, one area, one recovery. I don't do rhinoplasty, but I do have partners that do. And we've definitely run into that where someone's like, well, if I'm going to have one, I mean, I might as well just do them at the same time.
Exactly. Get all your pain and suffering over at once.
Exactly. Now, are you in solo practice or are you in a group setting?
Solo practice, but I practice with some dermatologists at Westlake Dermatology. But
And
I'm the lone plastic surgeon.
You're the lone plastic surgery. That's probably actually a very nice setup to be able to have dermatologists and plastic surgery together.
They kind of naturally feed off each other, and the two docs in our office are pretty sharp.
Yeah. What are you excited about in plastic surgery? Because you've seen a lot of probably amazing innovations over your career so far, but there's still so much coming up. So what are you kind of hoping for your personal practice that you're excited about?
It's strange. When I first started, I did a lot of lasers and then kind of backed off completely. And now I find I'm using them more as an adjunct again and kind of relearning some of the things and learning the new technology. The ultra clear laser is the one I've been kind of hanging my hat on lately. It's just, it can do so many different things and it's very safe, very safe.
And I think that's a big thing right now. There's a lot of people performing lasers who aren't safe or don't really know what they're doing. So having something that is safe and someone who is qualified to be able to do it is really important, especially in a city like ours.
Right. I mean, yeah, there's been some things in the news recently about lasers and radio frequency that, patients getting hurt. So, I think as physicians, we're always thinking about safety first.
Other than lasers, are there other devices that you like utilizing in your procedures?
I've been using the smart liposuction device. I don't really like that name so much. I prefer saying laser assisted liposuction. I think that's much more descriptive. And I kind of didn't give it much of a chance before I started in this practice and that modality was available. And I've become a believer.
So, how does the laser assisted lipo work?
Well, with the laser fiber goes in first, kind of liquefies the fat a little bit, but more than anything, breaks down that fibrous tissue that the fat is trapped in. And that just makes for such an easier extraction. I think even better than the old Vaser and the old ultrasonic liposuction. The laser really works and use such a small fiber that you don't have to have a large stab incision to get the device under the skin. But the bruising sometimes is almost zero. And I know that sounds crazy, but it's true.
Well, because you're using a more gentle way, right, than to extract your fat. What are some other procedures that you just love performing in your practice?
I enjoy abdominoplasty. I like blepharoplasty. That's another one it's quick, it's easy, it's relatively inexpensive compared to other surgeries. So, lots of people can come in and it's affordable. It makes people happy too, especially just doing an upper bleph in the office under local. Pretty much almost anybody can afford that and do something nice for themselves.
I think upper blepharoplasties are becoming extremely popular. I think that we have more celebrities who are being open about having smaller procedures, and I think when, like you said, people realize, okay, it's affordable and it's a fast recovery, and you can get a pretty dramatic change on the right person.
Correct. Yeah, people are usually happy. I don't think I've ever had a patient that said, I wish I would have never done that blepharoplasty.
Do you ever do them asleep, or would you say the majority of yours are awake?
Uppers are almost always awake. Lowers, I like to do transconjunctival. So, you can do those under local, but it's not fun for the patient and it's not too much fun for me.
Yeah, that's my way of explaining it as well. It's like you can, but it's a little painful for everybody involved to do that.
Right.
So, other than plastic surgery, I know you have a lot of interests, outside interests, and I know that you and your wife actually have a vineyard, which I think is really cool. How did you get involved in that?
Well, our property's in the hill country close to Fredericksburg, and the wine industry there has been going gangbusters for the last 10 or 12 years. And my wife got really interested in wine, and so we decided to plant some vines. It's slow going. We haven't had any production yet, but we're in year 3. So hopefully by year 5, we'll have something in the bottle.
What's the name of your vineyard?
Oh, it's just the name of our ranch. We call it Schotterbach Ranch, which is German for basic. It's basically the German way of saying Pedernales. It's gravel creek.
Okay. I was like, it's all about the label for me. Got to have a beautiful label with it.
Right, something catchy.
Yeah. Have you guys always been big wine drinkers? And that's like, besides like it booming, that you're like, okay, we this is really something we could get into.
Not so much always. I mean, you kind of evolve. You're a beer and mixed drinks person when you're younger, and then as you get a little older, you kind of veer towards the wine end of things.
Yeah. Well, I know I personally come a long way from Arbor Mist. So there's a lot better things out there. But I think it's always important that, for anyone who's listening who is, not a physician, that, as doctors, we're people too, and we have a lot of outside hobbies and things. What do you feel balance is? So I love being a surgeon. I know you love being a surgeon, but there's things that we all do to help us balance. And how do you find that balance?
I like going to my ranch on the weekends. It doesn't matter what I'm doing there. It doesn't matter if I'm fixing a fence or cutting down a dead tree or fishing in my pond or walking through the grapes. There's always something to do, always something to relax, and to break a good sweat. And when I'm there, I'm at my most calm. There's no doubt about it.
It's nice to have that little bit of a balance sometimes, and then that way when we're in the OR, we're focused 100% because you have that outside. Are
Exactly.
any of your children looking into the medical field themselves?
No, none of them are. I have one. I have five children. One has finished law school and is working. One started law school last month, and then my oldest actually got accepted to law school this week. So we're in the
So
lawyer business here.
a few lawyers.
Correct.
Well, that's very impressive. I'm sure you were very proud of them.
I am, and they're all the lawyer types. I mean, they're critical readers and critical thinkers, and they want to get out there and live their lives. I mean, it's hard when you're a doc, when you're training for a long time. It takes away some of the best years of your life. It's worth it, but you can't get those years back.
Well, I think somebody once said that, there really isn't balance. You figure out where you're willing to sacrifice and where you are willing to, achieve different places. So I agree with you. You do give up some years, but I think that, we're very lucky to do what we do. And
Exactly.
and then eventually, as you get further into practice, you're like, you can then start getting a little bit more of that life back.
Right. Long-term pain. Well, no. Short-term pain, long-term gain. Yeah.
Long-term gain.
Yeah.
So, what are your thoughts on AI in plastic surgery? Do you see that becoming part of your personal practice or just in general in plastic surgery?
Maybe it'll become part of plastic surgery in the future, but it's not going to become part of my part of plastic surgery. It's funny. Our specialty really hasn't changed that much over the last 30 years. I mean, it's still all just cutting and sewing pretty much, doing it the right way, but it's cutting and sewing. And I don't know if AI is going to help us out doing that or not.
Yeah. And I think it's funny, like, there's not really, yes, there are maybe less invasive things that we do, but we are a maximally invasive our specialty because that's how we get the big changes we get.
Right.
So they always used to say we're not quite Q-tip doctors, right? You got to operate with the knife and you got to do something to make these big changes. I do think that things that I'm excited about that, eventually I think we're going to get better and better at making more predictable scars. I think that that's one thing that I would love to see in the future. But like you said, I don't see us suddenly changing dramatically just because of AI, at least in the aesthetic world.
Right. I agree with you completely.
I'm married to a pathologist, and he sees his job being replaced very quickly. Pattern recognition, and he's like, "Yeah, a computer could be doing my job in no time."
Yeah. Pathology and radiology kind of need to be on the lookout, I think.
Yeah, yeah. So I think we have a while before robots are fully doing our surgeries. So I think probably at least for our careers, we're probably in a good place for right now.
Yeah. I think I'll be retired by that time. That's for
Yeah.
sure.
What do you think you're going to be looking forward to? Like, what's retirement going to look like for you? Because I know a lot of surgeons who just retirement is maybe falling over in the operating room. So, what is retirement going to look like for you?
I don't know if I'll ever completely retire. Um, I think I'll still always want to do surgery. I'm sure my repertoire of cases will shrink and shrink and shrink to the point that I'm only doing certain things. But I could always see myself, seeing patients and operating Monday, Tuesday, Wednesday, and then having Thursday through Sunday off at some point. Not that that's anywhere close right now, but I don't know if I'll ever completely retire.
I could see that as well. Like, it's like you just shrink down to where maybe it's a little more leisure and a little less work. But I think that partially is because I know that our particular specialty has a very high satisfaction rate. Like we're happy with what we do because we get to make people happy. Um, are you in any time in the near future thinking about making dramatic changes, or you feel like, what, this is probably where I'm going to be? Like I'm going to be in my solo practice with my dermatology group, um, probably until I retire.
Yep, that's the plan. I will be in this job until I retire. I think if I am, yeah, it's definitely where I want to be. I'm in a good place.
Is there anything, we talked a little bit about like things that might be interesting coming up. Is there anything that you are anxious about in our specialty that you want, like that you feel like we need to be careful to not to avoid as we continue to progress in plastic surgery?
Oh, that's a tough one. I get asked a lot of questions about internal bras and meshes and things of that nature. And I haven't come to a point where I think I need those devices to get the results I want and have them last as long as I want. I'm always worried about those kind of implantable things. I mean, breast implants been around forever, great safety record, soft tissue augmentation like the chin, but those kind of meshes just, whenever I hear the word mesh, I start to worry.
Yeah. Well, and I mean that's a fair thing because there have been meshes in the past that were so perfect and then they weren't so perfect. There were a lot of issues with it. So I think it's good to always be cautiously skeptical with things. And if you're getting good results, there's no reason to throw the kitchen sink at somebody.
I had an old professor that would say, don't be the first person to try something new, but don't be the last either. Somewhere in between is probably the sweet spot.
Yeah. Well, I'm from Missouri. We're the show me state. So it's, we'll show it to us first and we'll think about it a little bit. Well, this has been awesome. I can just tell from talking to you that you just probably make your patients feel so relaxed and comfortable. Bedside manner is an art form, just like surgery is. I can't imagine your patients don't just feel so comfortable and warm with you.
Same with you. I mean, you made me feel comfortable. So I'm sure you're exactly the same way with your patients.
It's fun to joke around. I always tell people that, if you want to be a surgeon and make relationships with patients, plastic surgery is the place to be. Because I would imagine that you've probably not only taken care of some people for a long time, you've probably taken care of whole families and groups of friends.
You're right. I mean, just recently, I kind of made a post to one of my social medias that I'd done the mom's breast augmentation 15 years ago. I did the daughter's breast augmentation 6 weeks ago. So it's just, generational plastic surgery.
And that's 15 years of trust. I mean, that's pretty impressive.
It's nice when you have someone, anytime they have their children come in or they refer their parents or their grandparents, to the interfamily referrals are always special.
That's really awesome. If somebody's listening, they're like, I have to see this doctor. He's amazing. How do they find you?
You can just go to westlakedermatology.com and you can make an appointment right there on the website.
Now, I know Westlake has multiple locations. Are you at one location or more than one?
There's 2 here in Houston, and I'm at the one in Westview on Bissonnette.
Follow Dr. Streitmann, learn more about his procedures. But thank you so much for being on the show. Is there something you would like to leave our listeners with?
When you're thinking about plastic surgery, try to find a board-certified plastic surgeon. Plasticsurgery.org will list every board-certified plastic surgeon in the United States and Canada, and that's a good place to start.
I second that. We can't ever make guarantees, but at least there, you're with somebody safe who can handle not only the good times, but if something bad happens, they know what to do safely for you. So thank you so much for being on the show. And thank you all for listening to this episode of The Confidence Doc. I hope, as always, that you learned something new.